morning, everyone. Thank you for joining us this morning for our workshop on teleconsultation to support students with ASD. For those of you rejoining us from yesterday, welcome back. For those of you joining us for the first time today, welcome. You're in for a real treat. We shared some great information yesterday, so if you missed it, please feel free to, in a few weeks, look for part 1 on our YouTube channel. And we are found on YouTube under UM-NSU CARD, UM-NSU CARD. And you can view both of these sessions in a few weeks. I am getting some questions about CEUs. If you are a psychologist or a behavior analyst, we are offering CEUs, and they are for both days. It will be 4 hours in total. If you have not signed up for CEUs, please go ahead and message me in the Q&A, and I will take your name down and figure out a way to get you on the CEU list. So, and not to take up too much time today, I'm going to do a brief bio for our speaker today, Dr. Erin Fisher. Those of you who joined us yesterday will realize it's the same thing, but you know, for new folks or for folks watching this video without seeing the other, I think it's important that we introduce our speaker again. So it's my sincerest pleasure to welcome back Dr. Erin Fisher. Dr. Fisher is the D. Endowed Professor of School Psychology, an Adjunct Assistant Professor of Psychology, and the Director of the Uni-Home Interdisciplinary Pediatric Feeding Disorders Clinic at the University of Utah. He's a licensed psychologist and also a licensed board-certified behavior analyst. He's worked with individuals with ASD, as well as social, emotional, and behavioral problems, and their families for over 15 years. His current research focuses on telehealth applications to support behavior and mental health for children, educators, and caregivers. I also want to add my personal note again. You know, I'm just so proud to know Erin and to have seen his professional growth into an expert in the field of telehealth. He got his start as an undergrad in several of our labs at CARD at the University of Miami. And nothing makes me happier to see his success and see him kind of surpass his mentors in his skill base. So please join me in welcoming Dr. Fisher virtually.
Thank you so much, Jen. I really appreciate it. And I'm really excited to be joining you all again today for the second day of our workshop on best practices in teleconsultation to support students with autism spectrum disorder. And we'll make sure that we get everyone up to speed, particularly for those who maybe didn't attend part 1 of this training. So before I get started, like Jen had mentioned, I really have to give a huge shout out to UM-NSU CARD for just all of the foundational support. This is a picture of me when I was working in the lab, in one of the labs at CARD at the UM campus. And I'm just really grateful for all the experiences I had while I was there. They really are the cornerstone, I think, in the community, helping individuals with autism. And I'm just super appreciative of the experiences, the opportunities, and the amazing folks I got to work with while I was there. And I really think about them often and really strive to create a program similar to what I learned when I was there. So a huge shout out to them and for everyone who utilizes their services in the community. I also want to give a shout out to all of the incredible folks I have the opportunity to work with here at the University of Utah. We have over 30 members in our lab, the University of Utah Technology and Training Education Lab, which really includes undergraduate research assistants, graduate assistants, as well as postdoc fellows, staff psychologists, staff behavior analysts, and just really a strong team of folks who really care passionately about transforming education. And really improving the lives of students, particularly those with disabilities, students who might be more marginalized in our communities, particularly students who are Black or Indigenous, or students of color who we really need to pay close attention to about how we're supporting and how we're transforming educational experiences for them. And we're really grateful that we get the chance to work collaboratively with many of the school districts in our community who have that same passion, who believe strongly in the work we can do to help folks in our schools, both the students and the staff as well. And I want to give a shout out to those districts. This is Washington County School District, Granite School District, Canyon School District, Salt Lake City School District, and one of our funders, the Cambia Health Foundation, which is the nonprofit that really stems from Blue Cross Blue Shield in the Pacific Northwest. And so we're really grateful for their advocacy and support in the work we do. And speaking of the work, we really are looking at multi-tiered systems of support, and how are we changing systemically the work that's happening in schools around mental health for children and the adults in the building, as well as families. We're also looking at multi-tiered behavioral supports through consultation. We're in a variety of Title I schools within our community, really trying to improve educational, social, emotional, behavior outcomes for students and the staff that work with them. We also are able to work with some of the most marginalized students in the communities, particularly around disability and some of the presenting problems around mental health through public school day treatment programs, where we're really supporting to keep students within their home schools rather than sending them out to community-based mental health providers or kind of institutes, psychiatric institutes, to keep the continuity of care, to make sure that when people need more supports, particular students with disabilities, that they're able to be with their typical peers in general education settings to the extent possible. We do a ton of professional development, which all of you are joining me for today, which I'm super grateful for. It's one of my favorite things to do is just share the amazing knowledge that I feel like I've gained through my training and my experiences doing this work. And we do a lot around functional assessment and function-based treatment planning. Last but not least, the kind of biggest part of the work that we've done historically is teleconsultation. And as we'll talk about a little bit today, with these COVID-19 restrictions that are in place, the teleconsultation work that we have done and that we continue to do becomes so relevant. And I really want to highlight that the work that we've done with Washington County School District around teleconsultation, particularly to support special education teachers, paraprofessionals, and families who serve students with disabilities, and particularly students with autism spectrum disorder, has been a real highlight of the work we've done. And I'm really excited today to talk to you more about kind of the nitty-gritty details about how you can support through telehealth and teleconsultation. So with that being said, let's do a kind of a quick day one review for folks who maybe weren't able to catch part one yet. This will also be available online, so you can kind of go back if you're starting here, but I wanted to just make sure everyone's kind of caught up and up to speed. So yesterday we talked a lot about conceptualizing teleconsultation to support students with ASD and their families. We took this kind of 10,000-foot view, talked about the current COVID-19 restrictions that were in place, as well as the implications of school dismissals and how we could support students. And as many of you who are joining me today probably know firsthand, this was a challenging shift. It happened overnight. There wasn't adequate planning or preparation, but we did our best. And it was incredibly impressive to see conceptually how people were trying to do this work. I still think we have work that we can do, and you know, evidence of everyone joining me here today, this is really showing how important this is to you all in your practice. We also talked about which technology features to consider when selecting video conferencing software. This is really important, not only for the HIPAA and FERPA considerations, which we'll dive into a lot today, but really just thinking about where to begin and thinking about engagement kind of on that 10,000-foot view. Today, we're going to talk a lot more about how you get engagement and what happens when you don't have engagement and how you can approach those in an equitable fashion. We also talked about the research base of teleconsultation to support students with ASD and their families. Luckily, there's a great amount of research that's out there. It's been increasing the past 10 years. And I feel really grateful that myself and my colleagues, as well as some of the amazing students I've had the chance to work with, have been able to contribute to this research base so that folks who are joining us today and others can really consume this and hopefully use it to improve their practice with new tools that will make their practice just more effective and more accessible. We also learned about problem-solving teleconsultation as this kind of broad model in a systematic fashion, how you can make changes, how you can approach a problem, whether it be a behavioral issue, a social emotional issue. Just there's so many things that we can do if we take a problem-solving approach. And so this model has a lot of research supporting it. And it was one that we spent a lot of time talking through the steps. This is also available as a handout in kind of a one-page user-friendly version. So I'd encourage you to check this out if you want to have a resource that you can bring with you. And please, of course, if you have questions, don't hesitate to email me. We'll have some contact information available at the end of this presentation on the last slide. And I'm always open to answer questions. I'm happy to talk to anyone and everyone who's interested in telehealth and teleconsultation, who will indulge me in talking about these things. And last is we consider applications of teleconsultation to support students with ASD and their families, both in the school setting as well as the home setting when we have these more online-based learning that's going on, but also around more pediatric issues. We targeted specifically some of our interdisciplinary pediatric feeding work that we've done through telehealth, working with parents to help support these really important behaviors that we know have just profound effects on functioning for individuals with autism as well as their families. Okay, so hopefully that helps give somewhat of a summary and get everyone a little bit more up to speed. For day two, today, I want to talk a lot about kind of more diving into the work and the details. Let's think of day one as this conceptual, theoretical framework. What's the research? Today, it's like, how do you do it? I want you to leave today saying, I feel more confident. I can do this work. This is something that I think we can do, and how to actually go about doing it. So today we're going to discuss family school community partnerships to support students with autism spectrum disorder. This is such an important feature. I'm going to speak a little bit about some of the own experiences I've had doing this work, but there's a wealth of great knowledge and literature out there for people who really exclusively target these family school community partnerships. I think telehealth is a modality that we can go about doing these things, and one that I found to be incredibly successful pre-COVID, and during this time, it's even more important. We're also going to talk about how you can understand how to engage students, educators, and caregivers through various technologies. We're going to dive into each technology or each feature within technologies and talk about how you may leverage those things. And unfortunately, just with online education happening so recently for the masses, we don't have the best groundwork. We don't always have the best sort of roadmaps to follow. But there's been a wealth of information that's come out from many different researchers. And for our lab, we're hoping in the next year to really drive forward a lot of this research. We were really lucky, I think, in the spring semester to be able to look at innovative ways to engage students through technology and telehealth. And I'm going to share a lot of those with you today. We're also going to learn how to arrange the physical environment to maximize teleconsultation experience, both on the user end, as you as the consultant, or the individual working with either a parent, maybe a student with autism, or a teacher, as well as the space that they're in. Because these are really important considerations. During this time, we've been able to go into people's homes in really intimate ways that we haven't before. It makes very, very vulnerable the spaces that people are in. Whereas before, you're always going to a clinic, you're at a school, and now everything was flipped. And we're going into people's spaces that for many of them could feel safe. And for many of them, maybe aren't the safest of places and can have a lot of just issues associated with people being uncomfortable with their spaces being observed. And we'll talk a lot more about some of that today. And last but not least, we're going to understand some of the legal and ethical considerations for practice. It's really, really important that we're really having these topics at the forefront of our minds, because it's very easy in person to have breaches of ethics and security and legal issues. I think when you add technology, there's just an inherent extra layer. And we all know this because of our time interacting with technology. We've seen breaches of information. We know that schools are frequently being targeted for hacking to get personal information. And so we have to take extra precautions to make sure that this really is successful. Okay, so with that being said, let's jump into today's first topic, which is really going to be talking about family school community partnerships. With these partnerships, we're talking about caregivers, we're talking about community agencies, community mental health agencies, behavior analytic agencies. We're talking about after-school programs. We're talking about all of these auxiliary, but really important services that can help create connectedness, follow through, and consistency with all the work we're trying to do. And then last, of course, it's with the school that our students are attending. Now, for me, this image really kind of hits home because it really talks about the interaction that's happening across the board, that all of these people need to interact with this child-centered approach. We have to think about what is best for the children that we're serving. And this is particularly important during this time when we have the threat of COVID being contracted in our schools, in our communities, and we really have to be considerate about how it affects our students, particularly our students with disabilities, those with autism spectrum disorder. We know that to the extent that we can all come together and have a similar idea, a similar kind of goal, we can do amazing things for students. But all too many times, I see that these things don't happen. And it's a lot, it takes effort. And there could be bureaucratic issues why these things don't happen. It could be lack of sophistication in practice. There's a variety of reasons, and we'll talk about a few of those. And I'll give some of my examples as we go through about what's worked really well. And I hope that throughout today's presentation, you can kind of reflect about what you can do to take the initiative. Because I find a lot of times when it comes to family and school community partnerships, everyone's looking at everyone else to initiate and take that first step. And I think that if everyone has a commitment to the child, then we should all be taking the initiative to ensure that the outcomes are going to be as positive as possible. So let's talk about how we can create school, family, community partnerships. These are fostered across consultative services, collaborative meetings, and partnerships in student intervention, student assessment, and sharing of data. And when you read these words, you might say, oh yeah, like these are easy. I can do all these things. I will consult if needed. I'll collaborate during meetings. Maybe there's, we have some partnerships. I'll go to the IEP meeting if I need to. And yeah, of course we share data. But to what extent are these things happening seamlessly? To what extent are we able to feel confident that everyone is being constructive? And that we're really implementing similar things across settings. I think this becomes incredibly important, especially I know here in Utah, we have issue where there may be inconsistencies where a school is implementing a behavior plan that looks vastly different from a community agency's behavior plan. And to the extent possible, we're always trying to find continuity and consistency. It requires an openness to collaborate on both parties. It requires an openness to communicate from both parties. And I think many times parents, the family piece, are kind of stuck in the middle of some of maybe the bureaucracies that occur between school and community. I think there can be times where there can be adversarial relationships between schools and families as well, and that's to the detriment of the student. I think that the adults in the school buildings are I think required, in my opinion, to be able to lean into these moments, to be able to be resilient and not take so much of it personally and say, yeah, you know what, we are going to lead the charge. We're going to understand that parents get really frustrated when their students don't get the services they need, particularly if they're seeing outcomes in other settings. So I think the collaborative piece is really important. Family school community partnerships, they're difficult to maintain and develop. They just inherently are because of the amount of effort that's required. And it's not as easy as just saying you're going to do it. There's a lot of aspiration to do these things, but when the rubber meets the road, it's really, I think, not always happening. And in my experience, it really, like I mentioned before, takes a toll on the student. And that's, I think, the last thing that we want, considering the circumstances that already exist. I mean, we already know that learning will be more difficult if they're receiving an individualized education plan. We know that there's many issues that can come in play. And so we have to be conscientious of all of them. When these relationships are successful, when parents are engaged in their students' academic progress, and student outcomes are really being targeted well, we can see student outcomes do better. But it really is about the relationships. And if you refer to our presentation yesterday, I spent a lot of time talking about the importance of building relationships. Everyone is extremely busy. Everyone is extremely stressed. During this time, it's magnified even more. But we have to make sure that these relationships are in place. And I think we need to model, as school districts, as community providers, model some of the professionalism that we would expect and be very empathic about how we're handling these things. I'm going to talk a little bit about some of the key points that I think are really important on our next slide. The great thing about contemporary technology is that it allows schools and families to access one another, as well as community providers, with just greater efficiency while promoting parent engagement in the education process. Let me give you kind of an example, one that's really salient for me. I was involved in a case here in Utah where I was involved as the board certified behavior analyst that was contracted to work on a case. And when I was working on this case prior to coming on, there was a lot of just inconsistencies between the school and the community ABA provider. And this was really having an impact on the student. The family was really, really involved. The family was really collaborating well with the community agency, but there were some major barriers when it came to just collaborating within the district. And as part of my role, I needed to bring everyone together. I needed to make sure that the student we were working with was going to maximally benefit from our collaboration to provide something more than just the bare minimum, right? We know we can't do that. We have to have something more substantive. And for me, I'm always thinking, like, how much more can we do feasibly? And I think technology just streamlines that process and make things less cumbersome, and allows us to just engage in different ways. So working with this group, we were able to bring our speech and language pathologist in. We're able to have our community ABA providers. We're able to have myself joining, classroom teacher, parents. And we had this team of folks that was really representative of the students' individualized education plan. And every 2 weeks, we would come together and we would show our data. There happened to be registered behavior technicians working on this case, and I was supervising those folks. And the wealth of data that we were able to get, which was just amazing, really informed our decisions every 2 weeks. And we would bring realistic problems to the table that maybe didn't always occur in the school setting, but maybe they happened at home, or maybe they happened in the community agency, or maybe they did happen at school. But because we could come together and talk openly in a safe and supportive environment, everyone felt comfortable to have these conversations. And we were able to really problem solve through issues and say, hey, this is how we're doing it at school. It doesn't mean you're bad because you're not doing it with seeing the same level of effectiveness at home. It just means there must be some environmental consideration that we haven't really dove into well enough yet. And we were able to just talk through the nuance and have these really sophisticated conversations about environmental conditions, about stress of parents, about some of the frustration of maybe hiring new staff, and the kind of nuanced relationships that we would see with the student who had autism spectrum disorder, and the sort of resistance of building new relationships with new people, and just the time it would take. And this experience may ring for you all true, because you maybe have had a similar experience. What we were able to do working with the student for about 2 years, it was transformative. And we were able to increase functional communication. We were able to increase time in general education setting with the support of paraprofessionals and registered behavior technicians. But from where we came in 2 years, it was amazing. And it was really a true testament to the work that everyone on the team came together. They put their egos aside, and they really tried to work to improve the outcomes of this student. So that's just one example. And I really think with technology through this whole process, this was me in Salt Lake and interacting with folks who are much farther away. And the kind of really beneficial thing from that was that we all started to use technology very seamlessly. Oh, hey, this person's driving because the district happened to be very large. You can just call in, no worries. The technology allowed us to really be there in one place despite us being all over the place. And I think that was a huge benefit for me. When we think about creating these school family community partnerships, there really are 4 kind of broad terms that I've sort of kind of focused on in my practice and in my teaching when I do teach graduate students about this in some of our consultation and supervision coursework. And I'm going to talk a little bit about each of these. The first one is knowledge. Knowledge is really about what you bring to the table based on your training, your skills, your experience. And knowledge is kind of a double-edged sword. It's great to be super knowledgeable, but you also have to have enough insight to know what you don't know. And I know that I'm a lifelong learner. I know that I'm constantly trying to challenge the way I conceptualize things. I'm always trying to think how maybe an old way that I was thinking could be adapted to be more contemporary. And I think knowledge is this dynamic process where, of course, we want to be knowledgeable about the work we do, but we also, like I said, want to know how we can improve and keep learning. We don't want to come across as pedantic, as arrogant. Knowledge is a powerful tool to the extent that you have awareness of how you use your knowledge. The other piece that I think is really important is empathy. And these terms are in no order of importance. They're just kind of the things that I try to embody when I'm teaching and doing this work. We probably heard a lot about empathy. Empathy is critical. And I think as we can become more empathic practitioners, school providers, community providers, we can do so much more to improve the outcomes of the individuals we work with. Empathy for me is a really important driving force. And we have to remember that this is us being able to experience physiologically when we think about these things, and how we kind of respond in the same or similar way that someone who maybe experienced the actual circumstances. And this can be hard, right? You don't have to necessarily experience all of the same things, but it's allowing yourself to be put in that position, right? Putting yourself in this other person's shoes and really fully indulging yourself to allow that experience to really to be there. And that's hard. It takes work. It takes a lot of time reflecting. But when you can empathize with the circumstances that a parent might have who's working with a student with autism and how hard that can be, or a teacher who has maybe their own issues going on at their home with their children and they lose their patience at school, it's really important to know that there are always contextual variables that we can understand to allow us to connect better with people. And to the extent that we can do these things, it can be transformative. And I really encourage through all of this work when we're trying to make partnerships is that we're taking time to listen and to really understand what these circumstances are, and ask a ton of questions. This is for us to know we don't know everything. We don't know everyone's experience, and we definitely haven't lived those experiences, but it can be really, really powerful when we take the time to be empathic. And so I think it's just an important driving force that we have to have in the forefront of our minds. The next piece that I think is really critical is communication. And for me, and my students know this very well when I talk about this, communication is like the key to all of this. And not everyone has the same communication skills. This is a privilege to be able to have nuanced and sophisticated communication skills. And really what I mean by this is being able to regulate your emotions when you're talking to people, when you're disagreeing about things. But also knowing that communication is the driver of this and not allowing space and silence to take over these circumstances. Because I've seen all too many times where people will feel frustrated, people will feel defeated, and they will stop communicating. And one of the biggest things that I always try to push is that in the face of difficulty, of contentious situations, of adversity, we have to lean into these moments. We can't just be complacent, allowing space and avoidance to occur, because that doesn't solve any outcomes. We have to be able to have real dialogues about how to support students without taking things personal, without being accusatory, while always being constructive, empathic, and supportive. And then last but not least is follow through. Having the knowledge, knowing what knowledge you don't have, being an empathic human, and having good communication skills are really important steps. But if you're not following through with any of these things, then nothing's really happening. And one of the biggest things that I've seen, and where I think many times that our partnerships fall short, is that there isn't the follow through. There's such a lack of follow through. And again, let's be empathic to that. Why doesn't follow through happen? Well, probably because there's really difficult circumstances, trying to manage all these work requirements. Maybe there's really tumultuous things happening at the home. There can be a variety of different things why follow through doesn't happen, but we have to be able to constructively problem solve why they're happening, understand the context, and lean in to be able to make follow through actually occur. And so as we think about this topic, our first poll for today is, which school, family, community partnership domain areas will you intentionally focus on this fall? And I want to give you all a few seconds here to respond to this poll. And then I want to talk a little bit more about some of your results. So let me just pause here for a second for you all to complete this, and then we'll bring it back up once everyone's responded. Okay. Thank you, everyone who responded. I really appreciate that. It looks like, based on the poll, that the intentional area that you all want to focus on most is communication. About 50% of folks really highlighted that. And then I think it was about evenly distributed for the rest of the items. I really appreciate hearing that many of you find communication to be the one that you want to focus on more in the fall. The reason I'm really excited about that is because we're talking about telehealth. We're talking about a way today that you can use technology to increase your communication. And so thank you for everyone being open to that. I really appreciate you responding. So let's talk a little bit about barriers to family-school partnerships, because we've talked about, the importance of these things, but there are so many barriers that I think get in the way. And I think if we keep those terms in mind that I previously mentioned, it can really help contextualize a lot of this. Looking at the model on the right, this is Bronfenbrenner's typical model that you've seen of the social ecological model. I'm sure this brings some memories back from your early training, knowing that the child is really surrounded by this larger system that interacts on multiple levels. And we have to think about how all of these levels interact with our child that we're working with the students we may be working with, and knowing that it's this dynamic interface interaction between all of these different levels. So some of the barriers that we see are individual parent and family factors. As parents, it's probably like one of the hardest jobs. Teaching and being a parent, I think in my mind, are equivalently some of the most hardest jobs that we have in our communities. And we should really value those jobs because of the rigor, because of the emotional labor that goes into all of that work. And remember that for parents and family factors, there's a lot of different circumstances that play into the role of how well they can support their child. And some of these things could be parents' own mental health issues. During this time, I know that many more people are experiencing mental health issues. And so we have to think how we can be compassionate and supportive, making referrals if needed, but supporting parents and letting them know that this is a tough time and that it's okay to feel anxious, to feel depressed, but that there are great supports like UM-NSU CARD and other folks within the community who can help in difficult times to ensure that our students and the children that we serve and we work with are safe. There's other family factors too. I mean, the list can go on. We think about level of education. We think about housing stability. We think about access to technology during this time. We can think about substance use issues. There's so many things that go into this. And I think we have to be really, really compassionate about the larger circumstances that are happening. There are also these parent and teacher factors. So the relationship between the parent and teacher. And I think the way I see teachers in this really important role is they're like the case manager, particularly for our students with autism spectrum disorder who we're serving. They're really there to help guide the education. And so I see them in a really important role, one that I think should really model professionalism, should really be able to make sure that there are positive constructive relationships. But this is not always the case, and this can be hard. And it doesn't fall solely on the teacher. There are definitely times when I think parents can be frustrated and contentious, but we have to take that step back. We have to lean into those moments and say, okay, well, what's causing this? Why are these issues occurring? And how can I help, maybe as an educator, either refer to the appropriate services or maybe help myself if it's within the scope of my work? And I think as we think about education, teachers, related service providers, school staff, we're going to have a lot more responsibilities to provide social emotional supports, to provide mental health supports, and really not saying you're going to be the parent's therapist, the child's therapist, but you're going to be able to facilitate these foundational human interactions around empathy and compassion and support that they are prerequisites, I think, to be a great therapist, but they're also really just awesome characteristics of a good human, or a human who's really empathic. We also can think about individual teacher or school staff factors. And for me, this comes to, especially during this time, how are teachers feeling supported if they have children at home who they're also trying to educate during this time? This is extremely frustrating. It can be really stressful. What about other school staff? The level of training that they have received. I mean, I think many of us who are licensed in some capacity, whether as teachers or mental health providers, we have the privilege of our training and our education. I think all the time about my own children. I have a 5-year-old and a 2-year-old at home, and I was very confident to be a parent going into it, and that was immediately washed away when you realize that it doesn't matter that you have your BCBA, it doesn't matter that you're a licensed psychologist, because the emotions still run high when your children don't listen. The emotions still run high when these frustrating things happen at home. And I think that we have to also be empathic to know that parents, educators, school staff, they're all varying levels of competency and skills. And we have to think of this as sort of like ongoing shaping of people's behavior. We're continuously teaching and learning. We can't give up. I'm a strong believer that we can change almost any behavior, most behaviors, and some maybe just take a little bit longer because of the learning history. But I think for the most part, a lot of this is skill deficits, and if we can be empathic and constructive, we can teach a lot of great things to people in our communities as well as in our schools. Child factors. Some of the biggest barriers that I see with some of this is really what the children bring to the table. And I think when we think about children with disabilities, difficulty learning can be there, difficulty with social communication, rigidity, some behavior problems. These are all things that can make it more challenging. But remember, the environment that we create around these children is what shapes their behavior. And if we don't like something, or we would like to see something different, we need to arrange the environment in a different way. And this could happen at the house level, but also if we look at this model on this broader social context, where we may have to have larger sweeping changes to support our children with disabilities and to support our families, particularly during this time. And so the last piece is also the societal factors. And I just mentioned that, but we really have to think as a society, what are we doing to help support family school partnerships? What are we doing to make sure that there are adequate policies, funding, and supports to make sure that these things can happen? And I think we're really lucky. In every state, there's a parent center that can help support some of these collaborative engagements. UM-NSU CARD is another great place that I think is working in that societal change with its collaboration with folks who are in the legislature and really trying to drive some of these outcomes. Okay, so that kind of lays some of the groundwork about at least why I think this stuff is super, super important. I'm passionate about this work because this is the work I get to do. I have the privilege of doing family school community partnerships on the day-to-day, and it's super rewarding because you can see the impacts almost immediately once everyone can come to the table. Okay, so let's talk now about engaging schools and family through technology. So we talked a lot about these school family community partnerships, but how are we actually doing this work? How are we executing it? And if you go back to the presentation from yesterday, again, we'll dive into some of the technology, but as a quick summary, when we think about telehealth and the services that we can do to help support families and educators and students and community members, this is sort of the list of items that you could consider. Telehealth's really broad. It's kind of this umbrella term, and it includes everything from telephones or smartphones, email, text messages, mobile apps, which you may be more familiar hearing as mHealth now, video conferencing, which we're doing right now, and which is a ton of the work that I do, distance education, which many of us are newly familiar with, as well as virtual and augmented reality. And for virtual and augmented reality, I'm super excited about this work. This is where our lab is moving as we continue to do more research around training parents and educators around behavior management strategies in the classroom, social emotional strategies in the classroom, in safe, controlled environments that approximate the real world, so that when we actually go to these real spaces, it's no longer the individual's first time. We can demonstrate competency within a virtual space and then have them do exceptional work in person. And so this is all in the development stages, and we're really trying to push this forward, but we're hopeful in the next 5 to 10 years that we'll be able to have this work fully integrated in training programs across the country, really to help drive best practices forward and through this telehealth model. When it comes to technological considerations and technology in general, I want to ask kind of where you all are at with just technology. So you'll see the poll that popped up, and there's 3 choices. Would you consider yourself technology competent? Technology competent would be like, yeah, I got this. You know that there's ongoing work that has to be done, but you're not scared to dive in and Google search stuff. Technology neutral is like, yeah, I'm not opposed to the technology, but I use what I have to use, but you're not like diving in and geeking out like me, trying to figure out the different tools and ways to do things. And then technology adverse would be like, no, like I don't want to use technology if I don't have to. Please don't make me do it. I'm going to break it. This is going to be awful. So take a second here to vote on how you would consider yourself. There's no right or wrong answer. You're not bad if you are technology averse. Again, we're shaping people's behavior, being technology competent. I see it in that sort of similar context as multicultural competence, if you're like familiar with some of the psychological constructs that are discussed in training, where it's this ongoing work to be able to understand, to be able to reflect, to be able to just improve your practice. So as we think about some of these considerations, the kind of number one thing I think we need to talk about is doing your research. And it's, for me, it's one of these things where it's all online. You can just Google search these things and you have a wealth of information. It looks like for folks who are on the call today, it's about 50% who are saying they're technology competent, about 50% saying I'm technology neutral, and then about 7% who are saying they're technology adverse. And I really appreciate everyone being honest about that. And I hope through the next year that we can start to see more and more people become more technology competent, because unfortunately or fortunately, technology is not going away. It's going to be increasingly more integrated into our society. We're already all cyborgs because we all have a cell phone that we're using and connected, just not, inside of our bodies. And so I know that might be like a weird way of thinking of it, but we are constantly being more and more connected to technology. There are some probably like broader ethical issues that we could discuss a different time around technology integration. But I think it's a really helpful tool. So do your research, think about technology and how it can help you. Don't be scared to dive in and say, literally, how do I do this thing on this app? The good news is someone else has probably already asked that question. And most of these developers have gone through and created those frequently asked questions. We also have to think about consulting with your IT, your information technology specialist. Here at the University of Utah, I'm super lucky. We have one of the most amazing IT coordinators I think I've ever met. Just super helpful with all the questions I always have. He'll indulge me in geeking out about which speaker should I buy or what processor should I have in my computer. And I really appreciate people who are willing to have those conversations. And some of it maybe not knowing what questions to ask, but I think that they're a great resource. And I know they maybe get a bad rep about like maybe not being able to be the most constructive, but in my experience, I think IT services are becoming more and more ubiquitous. And to the extent you're patient and kind and open, I think this stuff can work really well in collaboration with IT specialists. Practice with the software. You have to take time practicing because I don't know about you all. For me, I'm really terrible at most things when I first do it. Like it's just not very good. And it takes practice and time for me to get better and better and better at it. And I think it's about that openness to learn stuff and to not know what you're doing. For the most part, you won't break any technology. I remember as a kid growing up trying to teach my parents. We got our first computer when I was in 6th grade, and I remember trying to teach them everything that they were supposed to do, and particularly my parents thinking they were going to break something, or it would just you would not be able to come back from this. And that's usually not the case with technology. I mean, I think you'd have to be really, really, really lucky, or have to know what you're doing to actually make these things break where you can't actually recover. So just some food for thought. When you're thinking about doing video conferencing particularly, and using this in your practice, do test calls. Make sure that you kind of, before your session starts, that you have the opportunity to test their technology, make sure that everything is going well, that they're feeling very comfortable. I think with many of the web-based video conferencing software, it's pretty seamless now. You just click it, it opens in your web browser. But there's always, I think, people who maybe aren't as proficient and need a little bit more of kind of that step-by-step scaffolded process where we talked about just supporting people where they're at. Be patient with yourself and your clients. This is a really dynamic time, and there's a lot of heightened emotions. There's a lot of uncertainty. Being able to work your computer or log onto a video conference or do this work may be not on the top of the list. But I think some people will need a little bit more help. You might need a little bit more help as the practitioner. Please be compassionate to yourself. It's okay if you make mistakes. It's okay if your clients are having a hard time. We'll talk about some of the plans that you can put in place and ensure that you can follow through if some of this stuff doesn't work in a little bit. Learn new ways to engage with your clients. And this is where I think we're going to have the most fun today, talking about all the fun engagement strategies that you can try to engage with your clients. And I think it'll be important when we talk a little bit at the end about what do we do for folks who don't want to engage or can't engage? How are we approaching that? How are we being supportive? How are we making reasonable accommodations so we're not being punitive because of engagement issues? And then we'll talk a little bit about that nuance. And I hope you all have some questions that I can answer around those topics towards the end as well. Okay, so when we think about what can we actually do to engage folks, I'm going to go through a variety of different technologies through the remaining time we have. And we'll end a little bit today on our ethics and kind of best practice considerations. So we talked about this yesterday. This was kind of the highlight of the work that we spent time talking about was teleconsultation. And this is a great way that you can engage folks, particularly to help support students with autism spectrum disorder. We've done this work in 5 school districts, 12 schools, 15 classrooms, and over 75 teachers and paraprofessionals served, as well as 200 students receiving supports through our teleconsultation services. These images here show a variety of different ways that you could engage all through our telepresence robots. Don't get me wrong, you could definitely use the static kind of desktop or tablet-based kind of stationary interface. But what we talked about yesterday, which is really important, is that kids move around. And when you're in a school setting, if you're in someone's home, there are real advantages to be able to look around and move around spaces. These robots, the Kubi and the Double, with the Doubles on the right and the Kubis are the 2 left pictures, are just great ways that you can engage with folks, but also dynamically look around spaces if needed. Another really, really important area where I think technology, particularly teleconsultation, can come into play is around virtual IEP and team meetings. So this would be our typical IEP meeting. We're sitting around, we're talking about issues. Hopefully everyone's being collaborative and kind to each other and student focused. And we can really translate this to a virtual space. And this is what it would probably look like, you know, your similar Brady Bunch kind of view when you're on your video conferencing software. And I think it's really beneficial. Before COVID, like I mentioned earlier, we would have teams come together in this format and everyone would be able to talk. I think that there's some really nice nuanced ability to not talk over people. I think that there's a social expectation in video conferencing that there is more turn taking, which probably feels socially weird. I know coming from the East Coast, everyone's just talking over everyone constantly, and that's just like a norm, and no one, you know, blinks an eye about it. But what I found is that isn't always the norm, and particularly online, that it really gives space for more pause so you can have these more reciprocal conversations. In the beginning, it maybe feels a little bit more stilted because you're pausing, but you know, I think for me, it allows me to think less about what I'm going to say next and more to listen about what's actually being said in those moments. And I think through this virtual format with the chat feature, you can also do a lot of great communication so that you don't have to cut people off, but you can also interject your thoughts or your opinions without forgetting them. And I really appreciate this. So I know that what we've tried to do, and I've seen a lot of this, particularly in the past few months after COVID restrictions took place, was people joining group meetings, IEP meetings, and delivering it through this format. I hope we see more of it. You know, it really speaks to the parent who maybe has to work a job from 9 to 5. They don't have a chance to get to the school, but they do have a chance to take a lunch break. And we can have this meeting from 12 to 12:30 every 2 weeks to team about this student. Or we have the IEP meeting, we can base it around these times. We don't have to worry about the travel. I mean, these kind of circumstances can have a huge effect for folks who maybe can't make it to schools or can't leave meetings because they don't want to lose their jobs, or they don't have paid time off, or they don't have the ability to maybe engage in the same way. So I really think that virtual IEP meetings and team meetings through this format really should be almost like a staple. Like I'm thinking when at whatever point COVID is not impacting our society in the way it is, that we can see more people say, oh, every IEP meeting has a virtual link. Like this is an option. And all of our spaces where we're having IEP meetings have the setup so that people could join that way. That it's not this cumbersome thing, that we're not, you know, disgruntled that someone has to join through video conferencing. I want to see more of that. I want to see this be like an equivalent norm that people expect. Another really interesting piece to consider is around cloud computing and collaborating. And this has been one of the most amazing ways I think that we can share information. I mentioned that case earlier where we worked collaborating with the community provider, with the school, with myself, and we put everything on our cloud computing storage. And we had a HIPAA, FERPA compliant version that we used, and we would share all the information. Everyone would put their information out there. Now, if a parent had a question about what was going on, or what was that IEP goal, or you know, what do we have for the VB map, which is the verbal behaviors, milestones, assessment, and placement placement. I got it wrong, but for those who are familiar, you know what I'm talking about. And so for those measures, we can easily look at these things and we can easily take them to inform our practice. I think that's really important, is the accessibility that we get from cloud-based computing and collaboration. Now, to take it to the next step further, I might be in these meetings and we're working in real time, all of us on a Google Doc, and all of us are typing in what we think would be the IEP goals. Now, traditionally, it may be, you know, the teacher typing everything and we're all watching, we're sitting there kind of, you know, yeah, I think that sounds about right, that's good. But what if I have an idea? And what if I want to type that in and put it in? I think this allows for so much collaboration. I'm really excited about more people using not only the collaborative writing piece, but the data sharing piece. And I'm going to talk a little bit more about that. I have a slide to show you some of the real-time work that we do, where parents can log on in real time and see data being entered. They can see notes being entered. They can respond in real time. This really speaks to that communication piece and the follow-through, and we're trying to facilitate that with some of this technology. Also, another consideration would be an electronic reward system. This is one that we use a lot in our classes. Some of my students have been working with how to use this as a tool to help with some of our group-based instruction. We know a lot of teachers who use it for their kind of class-wide positive behavior management systems. This is Class Dojo. And Class Dojo doesn't pay us to use their product. We're just big fans because we think it really fits well with the work that we try to do. And one that I really like to use Class Dojo for is the group-based function. So there's an intervention called the Good Behavior Game. It's been around since like the 1960s. It's seen a lot of adaptations. And now in the more positive behavior interventions and support framework, it's about students being in groups and trying to compete with one another to gain the most points for doing the most appropriate things that are expected within the classroom. You know, raising your hand to speak, following instructions the first time asked. Some of these things can be really important. And I think when we can promote behaviors we want to see, when we can expect to see certain things and reward in a really positive way, this system allows us to do that. It also ties in really well because parents can log into their own students' data, so it respects the FERPA piece of it, and see their students' performance, how many points they maybe earned on their group. And I think when we use this system, we are never taking points away. We're not ever providing any response costs because I think it's a slippery slope that can be extremely punitive. We've seen clip charts in schools. We know when implemented poorly, which unfortunately so many of the times they are, we've seen the detrimental effects of that. And even the National PBIS Center recently put out some guidance around ditching the clip, which was like a great document saying, let's start thinking about using more positive, less punitive strategies that aren't relying on public posting of individual students for punitive reasons. So this is just one example, and I think a great way we can track electronic information and share it with families to have more of that continuity and really promote great cultures within classroom around things we want to see. Let's talk a little bit about electronic home notes. I'm sure for many of you, this is maybe something similar to what you maybe send home every day. This would probably be a really complicated electronic or regular school home note. And they're going to target things like work time, meal times, work with teachers, spelling, communication, social skills, speech, maybe transition. And so this is a pretty complicated one, like I said, but as a parent, you're like, yes, this is great. These are all the questions I have about my student every single day. How cool is it that I can get this information? Well, what we can do is take this information and turn it into a Google form or Qualtrics or whatever survey system that your district uses. And we can take this information, design a survey that really speaks to all of these same ideas on this electronic home note, and then take that information, we submit it, parents automatically get it. We can make sure that they get the Excel spreadsheet every day, that they can log on and they can see the things that happen, that you can respond back and forth. Because I know, and I'm sure for many of you, if you put the piece of paper in the book bag, there is a very high likelihood that it never makes it home. And I think during this time, we have to think about how we can have permanent products that exist without the risk of it being smushed up at the bottom of the book bag, or it never makes it home, or maybe the school home note isn't as favorable, the student sees it, they rip it up, they leave it on the bus. These things can all happen. These are all experiences I've had, at least, and I'm sure many of you can empathize as well. And so those electronic home notes can just be really, really powerful tools. The next piece that I want to mention is technology to facilitate data collection. And this kind of piggybacks off the school home note, but really takes, I think, what would be more traditionally more qualitative in the school home note. I mean, there may be some Likert rating scales or a direct behavior rating where you're saying, okay, on a scale from 1 to 10, how engaged was the student? We may see that on the school home note, but this that I'm going to show you now is what we use for some of our clients when we're working in collaborative formats with community schools to help support students. And what you'll notice on the top, looking across, is the month, the date, the class period. There's 4 class periods. This is actually a high school student we work with who has autism spectrum disorder. And we are tracking a variety of different behaviors: verbal aggression, physical aggression, attention-seeking behavior, tantrum behavior, elopement, and work refusal. And these are all frequency-based. And so we have a staff member who works one-to-one with this student and is tracking these in real time throughout the day. And as a supervisor, I can log in, I can see the data being entered in real time, and parents can log on too. We also have some really important behaviors we want to see increase for the students. So things like instructional compliance, so doing the work in the way expected, appropriate interactions, and these are like those pro-social behaviors that we would anticipate to see. Academic engagement, so to what extent are they doing the work? Are they actually engaged in doing it? Class attendance, so this is like, were they in there for the amount of time that was expected or in the required space? And then the reinforcement system that's in place, that they're able to earn some great rewards. And then, of course, if there is any tantrum behavior, any of kind of the problematic behaviors, we have ABC data collection that we can enter, as well as program notes. So let me just click this so you can kind of see the interaction going through this. And we've had this since the beginning of last year. This is just one example, all the way through this year. And you can see as I've scrolled through this video, and I'll walk you through it, anything that's listed as red, that was an incident that we needed to look at. Any of those black triangles on the side, those are all notes from either the supervisor, myself, parents, or program notes from the individual working with them. And like I said, dynamically and in real time, we can look at these things. This is kind of summative data about the goals. And then every one of those behaviors is tracked in a separate graph over the entire school year. So this is the entire school year. About every 3 days is shown on the x-axis, and then they're scaled differently based on the behaviors. But each of these we're able to track and in real time look at and know how we can improve. And I'm really excited about this because I think for our students with disabilities, we need to be able to have great documentation. We need to know if our services are working and how we can tweak things if they're not. They really feed into the effective decision-making that I think is critical to all this work. And so the cool thing about this, and why I wanted to show you, this was just developed on a Google Sheet that we have. And it's through a secure format. And yeah, does it take time to on the back end to develop all these things? Yeah, it does, but it's really just putting formulas in and calculating. I am always happy to wipe the identifying data from this and send it to you as an Excel sheet if you want to sort of have a kind of skeleton framework to work off of. I mean, I think you'd want to individualize it, but this can at least get you started. And so I'd really encourage you all to think about these very approachable, very user-friendly versions. And maybe that's a privilege for me saying that, being someone who studies technology, but I really do feel that this is a lot, very approachable, very easy to use. And you're not necessarily having to buy some commercially available or proprietary product. You can use what's available probably for free from your district to make these things happen. And so even if you're using something like Microsoft Teams, you can do something very similar within Excel for that. And so I really highly encourage this kind of use. Let's talk now about some of the new features. And yesterday when we talked about sort of how do you pick your video conferencing software, one of the things that we mentioned were all the new features that came out. And when we initially did our study to kind of determine what would be good features, these weren't available. So these are all new ones. I'm really excited to just dive into each of them with you today. These are virtual backgrounds, waiting rooms, multiple screen sharing, breakout groups, digital whiteboards, and polls, which you all have been doing today, which I really appreciate. Virtual backgrounds. These are some of the cool ones I found online. I'm a huge Star Wars fan, so I probably go with the Millennium Falcon on top left if I had the choice. I usually have to have a little bit more of a professional background, but what's really fun is if I get to ever pop in to groups, or I ever get to pop into any of the services that the students, that my graduate students are doing, I would really try to take advantage of some of these opportunities to have fun in the groups with the therapists who are doing it. And I think what I found with virtual backgrounds is this is an engagement tool. And it's an engagement tool for a variety of different reasons. One is you can have fun with it. You could share your screen with the individual you're working with and say, hey, let's spend today just figuring out what is the coolest virtual background we could find for ourselves. And you're on Google Images and you're searching for stuff together. It's a really connected experience despite being far away. It also serves the purpose that a lot of individuals are really not comfortable with the level of intimacy of you virtually being in their home, right? Think about that for a sec. You know, many of the students we work with, their home life, their circumstances, they're very different from one another. And many don't have the same privileges as others. And so their home environment may have multiple people living in them. They maybe don't have the largest space, maybe that they don't have enough privacy. And so I think virtual backgrounds gives a level of comfort and security that maybe folks wouldn't have otherwise. You can kind of design the space that you want people to see, to put forward, and respect some of the privacy that maybe people want. So I think it's a really cool tool to use. I'm always trying to use virtual backgrounds. Today I'm not, because I have a really professional background behind me. I'm on campus at the University of Utah. I was able to get permission to come on campus for these webinars today, so you all had a stable connection. So think about virtual backgrounds. Think about how you're using them to support the students you work with. And I think we're seeing these types of features. Granted, a lot of it will be talked about through Zoom because that's what we use at the University of Utah in our lab. But I think we're seeing more and more software. Like I think Google last week just announced that they're making updates to include virtual backgrounds and many of the features we're talking about. So I think these will become ubiquitous elements of the technology as we move forward. Another consideration is waiting rooms, and waiting rooms are very, very important. Hopefully none of you have experienced Zoom bombing, but it's a really nice way to safeguard if there are people trying to get into your calls, despite maybe some of the security protections that you put. So I always am trying to enable waiting rooms. This is just some images of what that looks like. And really the nice thing about some of the new waiting room features, you can chat with people who are in the waiting rooms. And I think that when you're doing either IP meetings or you're working with multiple people across different spaces, you can make sure that you let people into your space. It feels like in the same way if it was in person when you're ready to. Maybe you need to have a candid conversation before inviting certain people in. Or maybe you need to have a conversation who's not really adhering to the norms of the meeting. You can ask them to hang out in the waiting room for a second. Maybe you like talk to everyone in your group, maybe talk to that person separately and then bring them back in. I just think that there's a lot more navigation that's available. And again, we're trying to get as close as we can to those in-person interactions. And I mentioned this yesterday, but I see telehealth as a face-to-face modality. And we've heard people talk about face-to-face being in person. And I'd like to kind of separate those. In person is, I am physically in the same space as you. This is face-to-face. And we'll talk about how to approximate that a little bit more in a little bit. Multiple screen sharing. So this is a cool new feature where I maybe want to show you something that I'm working on, or that's really cool to me. But maybe the user on another side wants to also share something. And before, we weren't able to necessarily do these things. Now we can have multiple shared screens. We can look at multiple things dynamically from multiple people rather than have this more stilted thing. Because I know in the real world, when I'm in a classroom working, or if I'm in a meeting working with people, a lot of times people have stuff that they want to show. And it's a little bit weird if we're all just putting pictures up on our screen like this. Can you see this? Can you not? This really allows us to dynamically do some of those things. The next one I'm going to talk about is breakout groups. And breakout groups are amazing. If you haven't had the chance to use those, this to me is where we should be allocating a lot of our resources when we're trying to help folks. For the groups that we run, and this is kind of an example, you can really customize not only the name of the breakout rooms, but it allows for dynamic conversation. If you're running a group, and for us, a lot of times it's a anger management group or social emotional learning group or social skills group, we want to have people be able to have smaller conversations. And so what we might do is put smaller groups of the larger group. Let's say we have 4 students, 2 in one breakout room, 2 in another. It's usually a main therapist and an assistive therapist, and they're going in those spaces to have some of these conversations. And it allows more people to talk, to give space to them to communicate, maybe if they don't feel as comfortable in that larger setting. We also do it at the end of some of our groups when we go to the reward phase. Sometimes in our groups, not every student has earned enough points to be able to access the reward opportunity. But we're really trying to be equitable in this experience. So we don't want to do an all or nothing thing, especially with this new virtual environment. So we'll say, hey, for that one student, when you join us in one of the breakout rooms, we wanted to follow through with a few more questions, and we'll give them more opportunities to respond to get those points so that they can join that group. Now, if this becomes a chronic issue and you have students in your groups who are engaging but kind of doing it really inappropriately, and then know at the end they're just going to be able to go to the breakout room and access those points, well, we can come to the table and talk about how you might be able to restructure the environment. Again, we can always restructure the environment, even this virtual space. Everyone can learn, and kids are always going to try to find the holes. They're going to always challenge the status quo that we have, and we have to listen and really figure out how we can do these things in an equitable way. The next area that I'm a huge fan of are the digital whiteboards. And this is probably one of the, I don't know, maybe the most fun for me. I'm someone who really enjoys art and drawing and just being able to have these like in-person interactions like I would with a whiteboard where maybe I'm drawing stuff on it. And so we can translate that through the virtual space. And some of the features, kind of walk you through these, you can write text, which I think is really great. So you can kind of structure things. If you have topics within your session that you wanted to go through, you can set some of that stuff up. You can draw. And the great thing about drawing, of course, is you can play games like tic-tac-toe or other stuff. You can put little stamps on there to show when you talked about things. And you can use your cursor as like a highlighter if you really want to draw their attention. And so the virtual whiteboard's great. You can erase stuff if you make mistakes, but I'd highly encourage you all to play around with this, to use it in your practice. If you don't have a video conferencing tool that integrates a digital whiteboard, I'm going to show you a separate technology software that you can use that's web-based, that you can augment sort of a video conference with some of these other tools. The other new feature, polls, which you've been doing with me today, which I really appreciate, are really, really helpful. Hopefully you feel a little bit more engaged when you get to respond through the poll. Hopefully you feel like we get to have a more dynamic conversation because of the input that you provided. And so I'm a big fan of these polls. A lot of these video conferencing softwares allow you to build the polls on the front end and then put them on. I want to give a special shout out to Valeska, who's helping us with all the polls on the back end today. It's really nice to have that support, but I think it's really something that you can set up and do on your own as well. All right, so which newer video conferencing features interest you the most? And you can, I think this one's a multiple choice, so you'll probably be able to select more than one. And feel free just to let us know which ones kind of interest you and which ones you maybe want to play around with a little bit more. And as you all are filling that out, I'm going to move on and talk a little bit more about some of these apps that you can use, these applications, and just different ideas about engaging folks through the virtual modality. So this first one is Nearpod. I'm not sure if many of you are familiar with it. I learned about this from some of the amazing educational technology folks I get to work with. And this allows you to do polls, drawing, matching, virtual field trips, which I think is such a cool feature. Integrate other apps into it. So there's one that I really like to use called Flipgrid. You can build that into your kind of pedagogy. Collaboration boards where everyone can kind of stick different things on there. Customized learning games, and then free SEL lessons, which I think is super cool. Nearpod is freely available for educators. I think there are some subscription-based ones, but the ones that we use are freely available. And I really, really enjoy having them as an augmentative tool just because of how dynamic they can be. Based on the results of this last poll, it looks like many people were most interested in the digital whiteboard and then some of the breakout rooms and multiple screen sharing. I really think digital whiteboards are the way to go. We do a lot of interface with that. Of course, there are issues, ethical issues, problematic issues that come up. But if you're familiar with the technology, you can easily stop allowing people to chat, to share screens. You have to be very familiar with the security features, which we'll get to in a little bit here. Another consideration is social media. Yesterday, we talked a lot about how we're using social media in some of our work, but I really encourage you to think about how you can leverage social media to engage your students. in safe ways, and your families in safe ways. And thinking about in the work you're doing, maybe having private spaces within the social media so that you can have responding. Maybe there's like a private chat or something like that you have, or a space that's set up so that you can do these things. Now you have to think it through and really think about the risks and the developmental level of the individuals you're working with. But I'll tell you what, if you're working with a secondary student, they are on these platforms. This is how they're consuming information. This is how they're learning. And I think we can do a lot to support students as well as their parents through some of these platforms and thinking about engagement through this. I mentioned Flipgrid before. It kind of has that, it's kind of like an educational TikTok where you're able to record these really amazing videos in this kind of nice dynamic store and forward way. I'd really encourage you to check that out. It's one that we're really starting to use a lot more. Okay, so with the last 15 minutes that we have before we open it up for questions, I'm going to switch gears and talk about ethical practice for telehealth kind of overall. And the first thing that comes to mind for me is that we have to practice within our professional competency. That's like the ethical piece to all of this. And it's very important. Everyone overnight started to use telehealth and technology, and not everyone was professionally competent to do so. And you may see a lot of people now start to say, oh yeah, well, we're going to be educational consultants and we can do this work. And that can be highly problematic. Everyone can learn these things. Everyone can become professionally competent. You're all joining me here today. That's evidence of your interest in becoming more professionally competent with this. And I want to walk through sort of some of the considerations to help you feel more competent in your practice and in turn be more ethical when doing this work. First is training and professional development. And really, I think when we think about these broad topics, let me break it down to what these things might be. Security, privacy, physical environment, rapport and therapeutic alliance, state organizational laws and guidelines, consent, and then of course, practical considerations. Let's jump right in. First is what makes this whole telehealth experience secure? Well, first and foremost, we have to think about the student data that we're working with, as well as the family data, all the information that's virtually traveling through all of our internet connections. And the only way that you can make sure something is HIPAA and FERPA compliant is if you sign what's called the HIPAA Business Associate Agreement, or the BAA. And what this says is that the company who is using your data is guaranteeing that they are taking all of the requisite precautions to ensure that no personal information is released in any capacity, that it's encrypted at a certain standard, that it is not able to be taken. It is really, really, really important you have this. And so when we heard a lot about Zoom. Everyone's using Zoom. Well, not everyone when using Zoom was using the HIPAA compliant version. Not everyone had signed the BAA with Zoom when they were doing this. And there were a lot of issues. We've used Zoom for about 4 years. And when we've used Zoom from the get-go, we've always signed that agreement because we've known how important this work was. And unfortunately, our federal guidance around HIPAA has kind of an associated piece called the high tech. It's an acronym, which really spoke to the digital technology and the need for these BAAs. Once we can kind of get that guaranteed, then we're thinking about storage of data. Are we storing it in a HIPAA, FERPA compliant folder? And if so, what permissions are we giving to certain people? We have to make sure that they're nuanced permissions so that not everyone sees everything, particularly when there's client information. You maybe have a large caseload. Disposal of data. Many of these cloud storages will maybe keep backups of these things, which is great, but you have to ensure that maybe the backups are being deleted as well, and that there's not lingering data that can be accessed in other capacities. You also want to verify people's identity. Many times you maybe are on a conversation, video conferencing, and their video cameras are off. And I think what's really important is that for some people, it just might make them feel uncomfortable. We shouldn't be punitive about that, but we should know these things on the front end to know that when people join, they might have their camera off. But I think it's very okay to say, I'm comfortable with you having your camera off. I just need to verify it's you on the other end before we start jumping in all these services. Can you just turn your camera on for a second so I can see you're there? Give me a thumbs up and you can turn your video off. Now, you might have to build in more explicit engagement strategies, more text or something like that to ensure that these people are engaged. But we have to be sensitive to people who maybe don't feel comfortable with being on camera. Particularly, I think for our students with autism spectrum disorder, it can go both ways. There may be some who are really comfortable and really get a lot out of this, and there may be some who are saying, I don't want to engage on camera. This makes me feel really uncomfortable, and I will not do it if I'm on camera. And I think our compassion, our question asking, our understanding, and having some plans about how we'll include them in this process is really, really important. We also need to make sure we have contact information. If there's anything that goes wrong or we can't get a hold of them, we want to be able to call the family to make sure that we can follow through and make sure everything's okay. Crisis plan. This is for me the really big hang up, or traditionally the big hang up for video conferencing is what happens being super far away and there may be a crisis situation. What do I do? It's really hard. It's not like they're in your office and you can say, I need you to stay here while I call the appropriate person. Maybe it's a mobile crisis unit to come out and do some assessment. But what we have to understand is we have to have a plan. We have to know what's going to happen. We have to know who to call and what those circumstances might be if there are a situation of crisis that we are present for, that we are observing. And then, of course, with recording, when you're creating a permanent product of any of the work you're doing, there's so many more layers because now you have something tangible, digitally tangible that you can take and share potentially. That could be problematic. It doesn't mean you shouldn't do it. It just means that you have to make sure that it's in these safe folders, that you're not leaving it on a device that isn't associated with it, and that you're doing a very, very good job of ensuring that there is no breach of that confidentiality. What makes it private? Well, what makes things private is thinking more about the environment. We're going to talk a lot about that, but knowing the location, the people that are around, sharing certain content, we have to make sure that we're not doing this work from a Starbucks. Right now, we're lucky. We probably don't have that problem. But before this was a lot of the conversation I had. Don't do this work in a public space. Make sure that you can account for the people who are around, because many of the students maybe aren't feeling comfortable. And especially from a therapeutic standpoint, we do a lot of telepsychology, psychotherapy work, is people are talking about really intimate, really vulnerable things. And we want to make sure that they are in a space where they feel safe. And sometimes there are multiple people living in the home. There isn't a lot of privacy, and we have to be conscientious about their level of comfort and reasonable accommodations we can make to try to make it more private. Headphones is a great way to do those things. And thinking about more of those is really important. Let me jump forward to the physical environment, and I'll talk a little bit about what these kind of how these come into play. And these are going to be kind of like nuanced details. So you might think, gosh, Aaron, like, why are you talking about these things? But they really do matter. And I just want to make you all aware of them. So in our physical environment, the place that we arrange for these sessions, as the person who's the initiator of the call, let's say it's the therapist, the school psychologist, the educator, we have to be conscientious of our clothing, because clothing can have an adverse effect on the bandwidth. The bandwidth is the rate at which the information travels online. And right now I'm wearing kind of like a small patterned shirt. But if I was wearing one that maybe had vertical lines or just like big polka dots, these are all going to eat up more and more bandwidth. So the recommendation is always a solid shirt, a lighter color if possible. The background that's behind you, right now I'm in like the least ideal background because there's a lot of stuff that's being encoded as the call's happening. And so to the extent we can have a blank background, I like to use those virtual backgrounds because I think it accounts for some of that and it kind of has it be more standardized. But thinking about the background, the space that you're in is really important. The people who are around, like we mentioned before, both on the student side as well as our side, the location you're in, that's critical. Again, please don't do these things in public spaces. And lighting, this is such an important piece. I'm sure many of you have sat on the calls where it's all backlight. There's no front-facing light. And it's this ominous, scary feel. You're being interrogated. You don't know what's going on. We want to avoid that. This is already, the video conferencing piece is already going to have some inherent kind of discomfort or resistance if they're not as familiar with it. And we want to produce kind of the best scenario with lighting as we can. Now, I'm not saying everyone needs to have their light kit set up like you're a YouTube star, but it's really easy, I think, to have good overhead light, have natural light, and just to be conscientious of what those things might look like. Camera position. This is another really important one. Right now, I have my camera set up, hopefully at a flattering angle for you all, but there's many times I'm sure you can see people where it's just an under view, and it's like very much under their head. It's not flattering, and you don't want to do those things. For everyone's sake, I think it's good to have a realistic angle as though you were talking to that person. And I don't know about you all, but I rarely am talking to people like this under their chin. And so I think some of those things can be really important. Sound and audio quality, this really affects the environment, especially if you get that echo or feedback. Headphones are going to be your best friend. I have my Bluetooth headphones on just so I don't have the cord, and particularly when I'm presenting, I like to move around like you've seen. And so those sound quality pieces can be really, really important. Eye contact is another one, and this plays into our next component. We talk about rapport, and this is the interactions that you may have, and just all those engagement pieces we talked about. We'll talk more about how eye contact looks in a second. Okay, so I'm going to jump in with the last about 5 minutes or so that we have before we open up to questions, and really talk about this rapport therapeutic alliance. This is a resource I would encourage you all to check out. It's online, I think through ResearchGate. And the group who published this was really right when COVID hit, building rapport with youth through telehealth. And they talk about setting up the environment, they talk about introducing telehealth, they talk about building a rapport, and these engagement strategies. It's a really useful, about 2 to 3 page document. It's just bulleted of here are all the things. I've talked about a lot of them, but I'd encourage you all to check some of this out with the time that you may have after this presentation. Consent for telehealth. This is really important. When you're doing telehealth work, you probably already have your FERPA form or whatever consent form to serve individuals in the school or in a community setting. But when it comes to telehealth, I would encourage you all to have your own additional telehealth access form. This is an example that we use. It's like a template. I'm going to show you this as it scrolls through, just what it looks like. And it's including kind of the software we're using. It's kind of knowing the security issues, kind of how they should set these things up. We go through and really scaffold everything. Here's how you log on. Here's how you sign up. Here's all the things that you need to do to make sure that you can access us. If there's any personal issues or crisis stuff, that one was the Safe UT app that you just saw, which is a kind of statewide crisis application for students. And then here's an example of one of the telehealth consent forms that we used that's been approved by the school district that we work with. And I really encourage you to reach out if you're interested in seeing this template, but also passing it through your own district or agency, because every state has different rules, and every agency or organization has their own expectations about what this would look like. The next one that I want to talk about is some of the practical considerations. And with practical considerations, again, this is like nitty-gritty details, but something like eye contact is not inherently available as though we were in person. So that's going to be a huge drawback from video conference, is that we can't make genuine eye contact. Now, right now, it may feel like I'm making really good eye contact with you. That's because I'm staring directly at the camera. I'm not looking at my screen. But what we know from the research is that if your gaze angle is approximately 5 to 7 degrees from the camera, and to make this really approachable, in between the camera and the top of the person's head that you're talking to, you're going to still be able to approximate really good eye contact. And if you really want to do it, you just look right at the camera. And I think for me as a video conferencing researcher, I've had to learn a whole new set of social skills to make it feel more connected during this format. Some of the limitations of video conferencing should be explicitly discussed with clients prior to any services, any teleconsultation, any individual services. Hey, here are all the things that could go wrong, and let's talk about what we'll do when they do happen, or if they do happen. We know that the acceptability of technology for consultative services increases with exposure to the technology. We did the study a few years ago, and really what it speaks to is the exposure. You need to be able to practice using this technology, and it'll get easier. You'll like it more. It'll be more seamless. It'll feel less socially stilted the more you do it. Are you still going to have Zoom fatigue if you're on a call for 8 hours? You bet. I do too, because I think that, again, this is an augmentative form of support. It is really not the end all be all. We really still benefit so much from in-person interactions, which can be so difficult during this time. And then ensuring sufficient internet connectivity in both locations. This is so critical, particularly for many of our students who don't have access to high-speed internet or computing. During this time, we have to really figure out what we can do to support them. And then having a backup plan for technology or if they don't have that technology. And APA has some great guidelines around telepsychology for this. I want to talk now a little bit, and I'm going to go past the 10:30 mark a little bit. I have about 5 more slides, so we'll probably open it up for questions maybe around 10:40-ish, but I think we'll still have plenty of time for your questions. We want to talk a little bit about state and organizational laws and guidelines. This is going to be different across every state, and I'd encourage you to check out this website. This is APA's, the American Psychological Association, as just one example, but they have a really great resource where every state is listed. It kind of goes down and synthesizes and organizes that information. Plus, it also has like a glossary of terms for the coverage. So as you scroll through, you all could find Florida or whatever state you may be joining us from. In this, I skipped down to Utah just to show you a little bit about what goes on here in Utah as far as services. And it really tells you all the really pertinent information around telehealth when it comes to reimbursement, audio and phone only, and it really kind of breaks down some of these requirements. Now remember, this is for licensed psychologists who aren't working through state boards of education, which many of you are. And what I haven't seen is many state boards come out and have any guidance around this. And so I'm very interested as time goes on to see how state boards will do these things. This becomes, I think, particularly even more important as we think about practice across state lines. In school psychology, at least the field that I have the privilege of teaching in, we know that there's a shortage of school psychologists. And when we look nationwide, there's a shortage of really qualified mental health and social service providers. This is called the PSYPACT, and the PSYPACT is a multi-state initiative where interjurisdictional ability to practice across state lines. And it's one that I'm very excited about because on July 1st of this year, we're talking about 2 weeks, it goes live. And in 2 weeks, if you're a licensed psychologist, you can submit to practice unlimited across state lines through telehealth, and 30 days time limited for transition services. Any of the states that are in blue, they have enacted the PSYPACT. That means if you're in a blue state and you get this licensure, which is really just one page, you will be able to practice within those states. And the states are listed here. This is kind of the states that are going to be moving forward, but it's one that I really, really encourage you all to check out because I think it has such great implications for the work we do. I'm super excited to see this. I hope that state boards of education will adopt something similarly, or even better yet, there might be some federal guidance to suggest that we can do some of this work across state lines. Now, these come with risks, but I'm excited because I'm a biased telehealth researcher who wants more people to do this work in schools and community settings. And I think that we can really access people in many different locations, people who live in rural areas, who live in remote and underserved areas. This is a great way we can do it. So I'd encourage you all to check this out a little bit more. The next piece that I want to talk about before we jump into more about access and engagement is this idea of telesupervision. And we haven't really talked much about that. This is the cover of the book that I recently edited in 2019 with my colleagues Ty Collins, Evan Dart, and Keith Radley, looking at a variety of different topics around school consultation, supervision, and school psychology training. And really some of the important things, because many of you are probably supervisors, whether it's behavior analysts or educators or psychologists in the community. We really have to think about the supervision we're providing, particularly through this telehealth format. In this book, we have 2 chapters that talk about the infrastructure development as well as more practical pieces to consider. Recording and sharing your information is a great way that we can use telehealth. Digital feedback, there's some great software that we use here on campus called Listen, L-Y-S-S-N. And that is a company that you're able to transcribe in real time the sessions, look at the text, but also gives a metric for motivational interviewing about how effective you were in sort of MI work, which is really fascinating. And my colleague here at the University of Utah, Zach Immel, was the founder of that company. And then also just being able to look at electronic records, and then of course using telehealth training to support practice through supervision. So I think supervision is a big piece. I could probably spend a whole 4 hours talking to you all about just that topic, but I think it's a really amazing tool that we have at our discretion. Okay, so we're wrapping things up with our next couple slides. This next slide for me is really important because I think it hits on some of the non-telehealth pieces as well that I think are important. But first, when we think about access and engagement, we have to say, does everyone have the hardware we need to do this work? Probably not. And what are schools and what are community providers, what are our foundations and the community doing to help support access to hardware? The good news is majority of people have a smartphone device, but if you have multiple people in the home, think about how many people are sharing maybe that one device. And so we have to make sure that almost everyone has access to their own device, that there's digital literacy that's happening for everyone. And luckily in our schools, they're teaching these things, but we need more efforts to make sure everyone knows how to stay safe and secure with some of this information. The software, luckily for video conferencing, it's usually the user, like the student or the family, it's free, but the host is paying for it. Internet connectivity, this is also a big issue we've seen across the country. School districts parking buses and creating hotspot locations so that families, particularly who were not able to access, can get these things. This is very, very important. And then bandwidth, just because you have it doesn't mean it's fast. If I have 10 people in the home, it's all being split across those 10 people. And so that's why we need really, really high rates of bandwidth. We need strong infrastructure for telecommunications across our country. Here in Utah, we're very privileged because we have the Utah Education and Telehealth Network, which gives access to high-speed fiber optic internet to every single school across our state, despite where they're at. And so we're really lucky to have at least the community access if needed. And I know that they've talked about increasing it more with of course, the current need with COVID restrictions in place. The other piece is issues of engagement. This breaks down to telehealth sufficiency. Like, is this enough? For many of the students with autism that we serve, it's not going to be enough. There are going to be practical barriers that maybe even get them to engage in the first place, or they can't log in. Maybe some of our students are impaired to the point where we still need in-person services. The level of prompting required, the level of follow-through is so intensive that we can't really benefit from this virtual space. So in no way am I saying this is the end-all be-all service provision. This is an augmentative tool to help for the students who can engage. And if they can't engage, we should take reasonable steps to try to shape their behavior if possible. That takes work. Just like in a classroom, you're trying to get them to engage, it takes work. But we can be purposeful, we can be intentional, and we can do it from an evidence-based standpoint. Are they able to log on? We mentioned that may be an issue. I think that's something to really consider. Also, are they able to maintain the interaction? Maybe not. And then does it require those in-person supports? So this next poll is, do you plan on practicing teleconsultation this fall? And I'm just interested, you maybe did it before, but I'm just interested after today, if maybe you're feeling inspired to do this more. Thank you for responding to this one as we're kind of moving through the remaining content. So to bring things back around and to summarize for today, we talked about the need for telehealth competency. You have to know how to do this work. You have to be able to know how to make sure that you can maintain a private environment, a private space. How are you securing your data? How do you ensure that you're protecting the personal information of the individuals you're serving? Are you getting additional consent? That's really important. What are you doing for outreach? How are you ensuring that everyone can get these services when needed? And last but not least, how are you training? How are you ensuring your professional competencies and development around this? Seeing the poll, I'm super inspired by you all. 93% of you plan on using teleconsultation this fall. 7% say not. That is totally okay for those who maybe aren't feeling like they're going to do that work. But I hope you feel more empowered with some of the knowledge that we talked about today, so that you know where to turn, so that you feel a little bit more willing or maybe interested in this. And for those of you who are there gung-ho ready to do it, I commend you for being able to see this work as something you can do, because I think it has a place for almost everyone in the work we're doing. And with that, I want to again acknowledge the text that we edited last year. If you're interested in reading that, if you take out your phones right now and pull up the camera and aim it at that QR code that's on the screen, that's going to pull up a website for the first chapter of that book that Routledge made available for free. It's our Teleconsultation chapter. It gives a great summary about pretty much everything that we talked about today. If that chapter interests you, please check out the rest of the book. And I'd encourage you to follow the lab, my lab. There's the website on there. We also have our social media account through Twitter. Please follow us on Twitter. There's a wealth of resources and great information that we put out frequently, as well as celebrating the amazing work of the students and staff in our lab. And I just wanted to take some time now to thank UM-NSU CARD for the opportunity to talk through this workshop the past couple days. And for all of you who have joined and learned with me, it's really been a privilege to talk to you all. I only reservations that we couldn't have done it in person. But I hope that in the future we'll get a chance to all connect. And I want to take this time now to open up for questions from you all.
Wonderful. Thank you so much, Aaron, for joining us today and for sharing all of your valuable input with us, and all the strategies and suggestions and techniques that you came up with. I'm sad we couldn't have you here in person as well. I think it would have been great to see you. But what better way to talk about teleconsultation than in a virtual environment? So I think it was very fitting that the topic and the platform that we used to give you all this information kind of matched. So we do have some questions, and I'm going to kind of start with the more recent ones and go backwards, because the more recent ones really pertain to things related to the HIPAA and the FERPA and all of that, and security, business associates agreements. And I had a couple of questions about how districts would know whether or not they're using a HIPAA FERPA compliant version, and also what the difference is. Are there FERPA only compliant platforms that aren't HIPAA compliant, and vice versa?
Those are great questions. In my experience, I have never found anything that is exclusively FERPA but not HIPAA. I think if it's HIPAA, it's FERPA. There are some nuanced FERPA laws. They vary state by state. So I think you'd also want to ensure that there isn't any idiosyncratic issue that maybe I'm not aware of, or maybe that you're not aware of. I think schools in general are employing these BAAs with almost any company that they work with. They even require these for just in-person work. So for all of the contracts that we have with our local school districts, as part of the baseline of that contract, we are signing agreements to know that we, with the district, are respecting that, and then the district is likely responding in the same way with the tech providers who are giving access to whatever technology. So I would say if your district is saying, this is our software, you're good to go. If you want to use something different and it aggregates student data, then I would encourage you to talk to your IT specialist or your supervisor to make sure that you wouldn't have any inadvertent FERPA and HIPAA violations. But I have found that school districts are doing a really nice job of really rolling these out so that staff can just take it and use it without thinking so much about some of these things.
Good point. I'm glad you brought that up. I think this one probably is a question that needs to be directed at the district as well, but I thought you might have some thoughts about it. We have a question here regarding kind of virtual IEP meetings and how successful they found this particular format to be now that they had to go to this format due to the COVID restrictions, and thoughts about continuing that practice even when things go back to live in-person interactions.
I really appreciate that. And I share the same kind of thought as you. I want to see these things happen more so afterwards. And I think it's being able to start having those conversations now, and really highlighting the connectedness, the engagement, the benefit. Take some data. For me, the data always speaks. Hey, look at how many parents actually showed up to these meetings. Hey, look how we got through these meetings in 1 hour, which typically would take us 3 hours. I'm sure many of you have sat through those IEP meetings like I have. We've found that through virtual IEP, it really helps make things a little bit more streamlined. We talked about this yesterday, some of the sort of extraneous language or communication or tangential stuff doesn't always happen on telehealth. So I'd encourage you to talk to your districts now, start collecting maybe some of your own data around some of these engagement pieces, and do some program evaluation essentially around what does it look like when we do this format. And I hope that many, many more districts will provide that. It's hard for me to think that we wouldn't, because I'm one to say you shouldn't take things away from people once you have access to those things, particularly if they increase efficiency or effectiveness in practice. That seems like it would be a really tough place, especially like I mentioned before, those families who can't get to a meeting or they want someone to join who is busy and can't get there. I think this really has some lasting utility.
Awesome. We had a couple of requests for that telehealth informed consent form that you had shown. Is it possible for participants to get a copy of that, and how might they go ahead and do that?
Absolutely. What I'll do today after the presentation is I'll upload our template into the shared folder that we have that has our resources, and that can be distributed to anyone who's joined this workshop for free as a way to just have that.
Wonderful. So for those of you who are on our CEU list, I have your emails, and I will be sending it out. I will also send that link once it's available to Georgina in Miami-Dade Schools, who can distribute it to you that way as well. If you happen to not be on either of those lists and want it, you can feel free to email me. I've listed my email a few times. Okay, so now, oh, another question. Can you provide some of the references and sites, websites, and links that you've discussed, perhaps in one document?
Sure, absolutely. I'm happy to put kind of all of those in kind of like a bulleted document so we can easily access those things. I think that there's a lot of great information to share for sure.
Perfect. Particularly, there have been a few requests for that data collection sheet that you had.
Great. Yeah, I'm so excited to hear that you all are interested in that. What I'll do is I will make sure to de-identify and take off any of the pertinent information, and I will put that up there today so that we have access to all of these great resources. And thanks again for everyone who's interested in sharing the resources that we have. We're not big on keeping stuff close. We don't think people need to recreate the wheel, so we're happy to share.
Wonderful. Okay, so now some non-resource specific types of questions. Do you have any recommendations for how to get parents up to speed for parents who are not particularly tech savvy?
Yeah, I really appreciate that question. We have had numerous parents who we've worked with who, you know, they join the conversation immediately. They say, I am not tech savvy. I don't know how to do any of these things. And I think it really goes back to just building that relationship and making them feel comfortable. Because when they're telling you that, they're really saying, I'm just feeling uncomfortable that something's going to go wrong. I'm not going to do it right. There's a lot of pressure. And so what we can do is use a lot of our consultative skills, our empathic skills to build the relationship, help them understand that we really are there to help, and taking baby steps. With technology, for the most part, it's very new. And not surprisingly, I think many parents of the children we work with now maybe know a few technologies that they use for work, but they're not as broadly knowledgeable about all these things. So I think finding good resources that maybe your district has, if you find that like 10 parents have the same issue, I would figure out a way to consult with district providers or your agency or whoever kind of designs products and create an infographic. I'm really big on infographics. If you go on our lab website and look at some of our resource manuals that we have for our programs, they're full of infographics. I think that the people absorb information through infographics like 75% versus whether it's just text, and I think it's something like 20%. So there's some real utility to break these things down into the most basic steps. If you think about it from like a more behavior analytics standpoint, a task analysis, what is the end goal and what are all the steps we can do to get there? If you spoon feed these little steps, we can guarantee that people can do this. And then I would also say, be patient. People make mistakes. Let's normalize that. Let's make sure that everyone feels comfortable to make mistakes and they don't feel ashamed. They don't feel embarrassed. We can laugh about it. I mean, before we went on the webinar today, Jen and Valeska and I were all just laughing about just all the errors that I made. And I'm a technology researcher. I mean, I think this stuff is just inherent to the work, and we just have to be, you know, compassionate to ourselves and others and patient.
Awesome. Okay, so let's see. Some folks wanted more information on the whole ditching the clip strategy or mindset or.
Yeah, I appreciate that. So like I mentioned, the Center for Positive Behavior Intervention Support, I believe it's out of the University of Oregon, came out with this really great kind of technical guide that they titled Ditch the Clip. And at least here in Utah, there's a lot of use of clip charts, and there's some real problems with clip charts. Now, we've seen schools who have done a fantastic job with clip charts, but they've really spent the time to teach and outline it, and to identify biases, systemic biases that maybe exist within the format, to try to disrupt those things. But that's not always the norm. That's not even happening across districts. It can happen differently school to school, and it can happen differently within each classroom within a school. And so for me, I think that I am one that believes that we should be getting rid of these formats, because there's a couple things. One, they're usually public posting of students, which means there's clips with all the names on them, and everyone can see where everyone else is at. Now that kind of could be a FERPA issue if you think about it in that way. There's a lot of personal information around their conduct that could make them more ostracized from their peers. So if there's a student who tends to get clipped down often, what do all the other peers think about that student when they see them on the red one versus the green one? And how do they interpret that student? How does the teacher interpret that student? And I think that what happens is the clip becomes a tool for the teacher to feel better about consequating problem behavior, rather than actually trying to reteach and promote positive behavior in the classroom. And so I think there can be major issues, and that's why I think if we can get rid of the clip system and use something like I mentioned before, the good behavior game, or other positive behavior strategies that really exclude some of the more punitive elements, we can do so much more for inclusion. We can do so much more to provide equitable behavior and mental health supports for our students. And so I'd encourage you all to check that out. I know that maybe seems like kind of a big change if you are using those things, but start by having those conversations and looking at the data and saying, gosh, like, who are the students who are clipped down all the time? Are these the students with disabilities? Are these students who are Black, Indigenous, or people of color, students of color? I think we have to think about these things on more profound levels. And I think that's why, at least in the guidance that they put out, they said that this really is something we should move away from and think about our multi-tiered preventative strategies that are just more positive.
So I think there's a follow-up kind of to that question, which is comparing those kinds of systems to Class Dojo and how that might be different.
Totally, I think that's a great point. Class Dojo could be used in that same way, where they have negative points. You can kind of ding people down for doing inappropriate behaviors. And so when we use guidance for Class Dojo, we say it's only positive. You can only give points to the students, because the absence of reinforcement is very powerful. We don't necessarily have to have a punitive response. And so what we're trying to do with Class Dojo is get more people to use it in a positive way by promoting behaviors that you want to see. Now, with any of these technologies, with PBIS as a whole, if you implement it poorly, you will be biased, you will be prejudiced, you will do disproportionate discipline. That is inherent, because we are all humans and we are all inherently emotional. That's part of who we are. But I think broadly, it's how can we transform these systems? How can we be aware of these biases? And how can we ensure that implementation is going to be effective for our students, particularly the ones with disabilities or those who are more marginalized?
Awesome. Do you happen to know if the good behavior game is available digitally to be able to do in a format virtually?
Yes, I love this question. One of my doctoral students just developed a web app for the good behavior game. She is frantically looking at how we're going to conduct this study in the fall, because we unfortunately don't think we'll be able to do research in many schools. But she created a web app, and really a web app is you just sign in on a web page. It pulls up a digital interface where you can put points, design the teams. You can do all the same work that you would do. But the cool piece of this is also has a chat assistant. So it's a machine learning where you can type in a question, and then it gives you a response. And so this kind of has no human interaction required. It can teach you how to do the good behavior game. And then if additional supports are needed, you could route to your school psychologist or someone else. But we do have a tool. We're hopeful to roll it out this year, get some initial data. And then there's other, I think, platforms that have used that, but we want to make ours kind of like freely available, non-proprietary, so that any teacher can pick it up, use it, and then have that data in a really substantive way.
Fantastic. I think there might have been one or two more that are kind of not completely directly related to the content that we talked about, but nonetheless, you might have some opinions on.
Sure.
So do you have any thoughts, particularly as students are working remotely, on how to incorporate accommodations effectively, particularly things like extended time for submitting assignments, so that students don't kind of get backlogged and accumulate more and more work to do?
It's a really great question. Yeah, I think inherently to this new format, we have to just give more time. And I think that we have to start to think about our assignments and the expectations, and realize that this is an unprecedented time. This is a time where we know people are not responding as they usually would. And so I think on the front end, besides some of those more individualized accommodations, what broad accommodations are we providing for our students? And some people may disagree with that, but during this time, I'm focused on social emotional supports. I'm focused on well-being, on behavior supports, on adaptive skills. I want to keep driving forward education. I don't want our students to fall behind, but I don't want to create an environment that's so aversive and such high pressure that like the question, the person who asked the question said, now we have this huge backlog and it feels so daunting, we'll never be able to complete it. I think we need to take a real look at what we're doing in our education system. And in many ways, stop trying to fit the square in the circle hole. We need to transform education on substantive ways that incorporates more learning accommodations, especially if this format's going to last a little bit longer.
Yeah, I agree 100%. And I think we have, a lot of questions and a lot of conceptual work to do, thinking about how to do this kind of learning with the variety of students that are in the spectrum, from the child who's very verbal, who may be included in general ed classrooms, but who is very reluctant to come online in a virtual format. And I know many schools and many teachers have struggled with kind of how to accommodate that particular issue related to social anxiety of being kind of part of the class that way. And on the other hand, for students who may have much less verbal ability, much shorter attention spans, and may not be particularly socially motivated, where I do think that we have had some teachers feel like maybe engaging in a virtual way and checking in with that student is not really all that useful or important, because that student isn't going to get anything out of that experience. And so I wondered if you had any thoughts.
Yeah, I really appreciate that. I think that we can't write off any of our students, and that all our students can learn, and all of our students can be supported. If we find that there's students who aren't engaging well in the technology, or they're averse to it, or it's uncomfortable, let's engage their parents more. Let's figure out ways that we can try to get more in-person interactions. Maybe it's, I'm gonna drive by their house every week, and I'm gonna drop off something from maybe a little care package with some cool stuff that they like, and maybe some activities. We have to think outside the box right now, and we can't just let the initial barriers allow us to just wipe our hands clean of this. We have to lean into those moments and be innovative. And I'm always happy to chat about this stuff. So I think if you all feel like you hit that wall, or you feel like it's not working, talk to me, talk to your colleagues, but bring many people together, because we have so much to offer. And I think it's about differentiating our instruction as educators, and how are we doing it during this time. We can't think that what we did in the past is always going to work, and there must be new strategies to include everyone in this process.
Well, I'm glad your thoughts align completely with mine. I think that is, oh, no, there's one other additional question that I think you might want to take. And then we are going to be at the end. So do you have any resources on research that has been published specifically related to telehealth access for marginalized students or minoritized students?
Yeah, there's some really, I've come across, I can't recall the authors offhand, but I do recall during this time that there's been some great data showing that our marginalized communities are really having the hardest time accessing resources for a variety of different reasons. And it may be, like I mentioned, there's multiple people in the home, and they just, the bandwidth is so low that they can't get on. There may be folks who don't have technology, And I think that we really need to start to think about more innovative ways, like I mentioned before, to access these communities, and really thinking about how, to the extent of in-person with the physical distancing restrictions that are in place, how can we still engage? What overt social efforts are we doing to try to engage these communities? Because unfortunately, if we don't, the disparities that we see will continue to grow, disproportionality will continue to grow, and we need to make purposeful attempts to disrupt those things. And I think it's all of our responsibilities as educators, as mental health providers. We have to do no harm. And I think if we're just not engaging these folks and just being okay with that, we are likely doing harm. And I think ethically we must do more.
Awesome. Well, thank you so much for joining us today. I really learned a lot, and that's always a wonderful thing. I hope the audience has learned as much as I have. Those of you who are getting credit for the course, your contact person in the district at Miami-Dade is Georgina Medeiros. So if you have any issues related to master plan points or questions related to that, please direct them to her. You can direct any CEU questions to me. And I know we can't applaud virtually in a way that's really meaningful, but I feel like I want to echo the statements of some of our folks who commented. Thank you for sharing and helping improve our educational capacities and skills. And there's another very, very sweet one. Looking forward to reading your book, and your passion and sincerity, not to mention your knowledge, are palpable. Thank you for this and what you do. The kids you work with are so lucky. And I couldn't have said it better myself. So thank you all for joining us today. And thank you very much, Aaron, for being our speaker.
Thank you. It was a pleasure. I really appreciate it.